If you followed my work, you know that I consider omega-3 fish oil to be an indispensable part of my daily regimen, and that I've recommended it for my patients and followers for decades. If you're already taking omega-3s, you should know that I've discovered a product so special that it's become my go-to brand. Dr. Jeffrey Bland, one of the luminaries in the world of complementary health, takes omega-3s to a new level. Omega-3 Rejuvenate from Big Bold Health is a premium blend of pure oils from wild-caught Alaskan cod and sockeye salmon, sourced from the pristine waters of Alaska. Unlike most other brands, Omega-3 Rejuvenate does it differently. The product comes straight from the sea into the hands of skilled fishermen, instantly flash frozen, and taken to their specially designed shoreside plant using a low-heat technique to extract the pure amber omega oil that contains all natural and abundant full-spectrum omega-3s, including EPA, DHA, as well as DPA, plus all natural vitamins A and D, and naturally occurring pro-resolving mediators to support cardiovascular, cognitive, and immune health. Their unique process preserves the natural goodness of the fish, so you get maximum benefits in every soft gel. No fillers, no shortcuts, just pure, potent wellness. Visit bigboldhealth.com/Hoffman and experience the difference. That's bigboldhealth.com/Hoffman for Omega-3 Rejuvenate. Use coupon code Hoffman20 for 20% off site-wide. Welcome back to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. February is Heart Month, and usually that is a product placement for make sure you get your cholesterol tested and get on a statin. But there are other ramifications to heart health, other angles, especially when it comes to lifestyle. But there's an interesting angle that relates to today's guest. He is Nathan Jones, CEO and founder of Clear Inc. Clear makes a dental line of products under the Spry label. The nasal products, Clear nasal spray, is for respiratory protection. So, Nate, explain to us the possible connection between oral health and cardiovascular health. That is something that is often under-recognized.
There's a fairly significant connection between heart health and oral health. And that was one of the first links. I don't want to say correlations. We don't know about causation, but we'll say correlation. Mm-hmm. And it goes back almost 20 years or more, where they've actually shown that poor oral health, poor oral hygiene, you have an increased risk of a lot of heart issues. And the reason for that is because if you have a lot of inflammation in your mouth, that inflammation in your mouth is allowing pathogens, it's allowing bacteria to go directly from your mouth into your bloodstream. Because, I use this analogy every now and then, and I think I've used it on your podcast in the past, but inflammation, a good way to look at inflammation in your tissue is take a bunch of beach balls and blow them up halfway, or fill them up with water halfway. And you can actually take 15 or 20 of those and make a wall that's fairly impermeable. Spray it with a garden hose and nothing's going to get through because they all fit together. Mm-hmm. And that's your tissue. Okay. That's kind of your tissue, your endothelium, exothelium, mm-hmm. whatever it is.
Yeah. Yeah. No, there's, it's like the blood-brain barrier, intestinal permeability. There's barriers that prevent pathogens from entering the bloodstream. Okay.
Correct. But now take those same beach balls and inflame them and fill them full.
Mm-hmm.
And now take your garden hose and spray that. And you get water going through it all over the place.
You blow them all over the place, yeah.
Yeah, because there's huge gaps when these cells get inflamed. They blow up and they're leaving huge gaps in between the tissues, the cells. And so you have a lot of bacteria and pathogens that are significantly smaller than the cells that can just go right through those cracks and get in your bloodstream.
You mentioned that correlation isn't causation. People have heart disease also often have gum disease, periodontal disease. But I think where the evidence gets a little more conclusive is when they actually isolate certain pathogens within atherosclerotic plaque, the same kind of pathogens that form dental plaque and cause periodontal disease. Like, you name some of the species, you're better at it than I am.
You have a bunch of them. I mean, I don't know the ones that actually cause the heart disease, but I would expect it would be, Performonas
P.
gingivalis would be one
P.
of them.
P. gingivalis and then
Yeah.
strep pyogenes, I think, are some of the names. Now also implicated, interestingly, in dementia and have Alzheimer's disease because what gets into the
And,
blood vessels
and
gets into the
Parkinson's
brain,
disease.
and Parkinson's disease, interestingly. So yeah, so I think that cardiovascular prevention, I mean, there are many aspects to it. One of them is to make sure that you're not walking around with pockets of infection in your gums. And it now appears that gum disease, from what I understand, is now surpassing cavities, dental caries as a cause of tooth loss. Is that correct?
It is correct. And this is my personal opinion. But I do think that the dental industry's myopic focus on using fluoride is what's driving that.
Mm.
And the reason behind that is because, going back to what we said earlier, the fluoride makes your enamel more resistant to the acid, correct? We can agree on that. Whether or not the rest of it is safe, we can't agree that it makes the enamel stronger and more resistant. If you make your visual symptom, less, but you don't treat the bacterial infection, which the bacterial infection is going to cause gum disease. Now you're going to have more gum disease than what you had before without you knowing about it, because you've made the visual indicator stronger and more resistant.
Mm-hmm.
So we're going to continue to see that. And we're going to continue to see increase in a lot of systemic issues with this correlation to oral hygiene until we actually address the bacterial infection.
So various ways you can apply the xylitol. You can get xylitol toothpaste, the spry toothpaste in various forms. You could even get it with fluoride if you so choose. I think there's one variant with fluoride, but I think these days a lot of people are wary of fluoride because of all the fluoride we get from drinking water, and then we get fluoridated products and dental applications. So we're getting fluoride 6 ways to Sunday, and we're using fluoridated toothpaste that adds to the burden of fluoride, which now concerns have arisen that it's neurotoxic. And has Utah banned fluoride, or is it?
We were the first state to ban it.
Interesting. And why is and Utah's kind of a like one of those a little bit of an ornery state, right? A little bit, shall we say, doesn't tread the beaten path.
Well, I think that in fact I chatted for a while yesterday with the congresswoman that spearheaded that initiative to get the fluoride out of the water, and really what made her do it was she actually read that she wasn't an anti-fluoride or an anti-vaxxer or a person like that, but somehow she got a hold of the lawsuit in California where they pointed out that using fluoride, the Cochrane group, this respected group that does meta-analysis,
very conservative, yes,
but they came out and said that using fluoride in all of its manifestations at best reduces tooth decay by 4%. Okay, not 25%, which is if you just do a Google search and it says 25%, which I still think is incredibly ridiculous. If you're going to the dentist and brushing your teeth with fluoride and getting fluoride varnishes and fluoride tablets, all of that to reduce your tooth decay by 1 out of 4, that seems ridiculous to me.
But it's worse than that. It's
4%.
4 out of 100.
It's 1 out of 25. It's like you're going to save yourself one cavity. And that's the Cochrane group, a conservative group. And then you look at all the negative side effects that can possibly come from using fluoride. And the American Dental Association says, well, we're all within the safe harbor. Well, the thing is that if there's no control on a toxic material that is put in our water, the people that are getting harmed are actually the people who drink more water. And people these days are, especially kids, they're walking around drinking these, what's the name of those thermoses they take to school and drink out of now?
Oh yeah, they're all the rage. You have teenage daughters, so every kid has to have one. And I don't know what they are, but Yeah. The kids in our family are all over those things. Yeah. They're
Yeah,
gigundo.
they're
That's why they have to
yeah.
wear these big honking packs to carry all that water.
I'm just like, we had a drinking fountain.
Okay. You're right.
We had a drinking fountain. After class, everybody would go line up at the drinking fountain for a minute.
Yeah. God knows,
You know,
God
but
only knows what came out of that drinking fountain, but yeah, we were
no,
okay with that. That's another story. And also a real danger to teeth because when some prankster would push your face into the drinking fountain, that could cause some really expensive dental bills. But that's another story entirely. We survived. So, all right. So that's the story on the dental products. You are always working with people doing cutting edge research. Any new projects or new research coming in on either the respiratory front or the dental front with some of these products?
I know that Dr. Cannon, we have a couple of papers that are getting written right now, and I don't want to say too much, but there's some pretty, and I think I've mentioned some of this before because we've been working on this for a couple of years now, and it's nothing that we're ever as a company going to take a product to market, but it has to do with xylitol and how it affects cancer growth. Because
Whoa.
if you look at cancer as a metabolic process, then the sugars that we eat all the time are feeding the cancer tissue. Cancer tissue has to have food also.
Mhm.
Correct me if I'm wrong, because
Yeah.
I'm not an
Well,
expert in
I
this
mean,
field.
in fact, the very scans that we use to detect cancer are radio labeled sugar. And we find that, cancer sites in the body light up with this radio labeled sugar because the cancer is more avid than the surrounding tissue for the sugar. It just really soaks up the sugar. And so you see these hot spots on imaging studies. These are called SPECT scans. Yeah.
So that's exactly right. And that's what happens. And so what they've done is they've actually gone to see what, and I mean, we were sitting on my back porch at my house with a bunch of doctors and dentists and discussing research projects. And where we started going off with the cancer stuff is you look at strep mutans, the bacteria in our mouth. It's a mutant. That's why it's called mutant. But it's a mutant bacteria that has actually developed over time, and it develops when there's a lot of free sugar available.
Mm-hmm.
And so the bacteria that are commensals usually will take a sugar and they'll digest or metabolize it fully, so it's not an acid because they want the energy. But if there's lots of free sugar, they just do a quick breakdown of it and get the easy energy out of it, and then they excrete the acid. Okay, so but when you put them in the presence of xylitol, they can't do that, and it ends up killing off those strains of bacteria. That's kind of what sugar's doing, or not sugar. Sorry, that's what cancer tissue's doing. It's hypermetabolizing, as you put it. It's rabid for that sugar, and so it pulls all that sugar toward it. And what they're finding in these studies, this is what I think. This is all what I think because I've read them, but they haven't gone out in the peer-reviewed process. They're actually in the peer-reviewed process. But what's happening is the cancer tissue can't metabolize the xylitol. And so you're really doing the same thing to the cancer tissue that it was doing to the strep mutans bacteria.
Would this apply to oral cancers only or nasal cancers only, or would it apply to cancers along the gastrointestinal tract? Because my belief is that xylitol is not absorbed so much systemically. In other words, you're not going to get a lot of xylitol going through your kidneys where cancer might arise. So it's more of a local effect of the xylitol, not a systemic effect of the xylitol. Am I on the right track?
I can't answer that question.
Okay.
I know that I know that in the studies what they did is I know they used it was over 100 different strains of cancer tissue.
Sure.
And they put these tumors in the rats, and then they would put these microosmotic pumps that would continually pour or drip xylitol into the tumors.
Oh, so direct application of the xylitol. So this is not like, take, spray nasal, spray, and I'm sorry, clear nasal spray, and it's going to make, you're going to absorb it and it's going to go to the cancer necessarily. It's not about that.
No. Well, back up on that, because there are studies out there where they use xylitol and it stopped the progression of oral cancer. and they were just using it in oral
That's
application.
a local effect. Yeah. No,
Yeah.
that might be more plausible because you're literally saturating the oral tissue with the xylitol, and that might, and certainly there's a use case for prevention because we're seeing an alarming uptick in the incidence of oropharyngeal cancer. It used to be unheard of in non-smokers. If you're a smoker, you had high risk. And especially if you're a smoker and a drinker, that you give you high risk for oropharyngeal cancer, which, could be a death sentence, very serious cancer. We're seeing more of it due to HPV, which is sexually transmitted. It's sexually transmitted through oral sex. And now the majority of cases, 2/3 of the cases are not in non-smokers, non-drinkers, non-alcoholics, and people who simply acquired it through oral sex. This is now the trend. And so now they're pushing the HPV vaccine. They're saying it's not just for genital HPV infections and cervical cancer. They're saying it's now prevented for oral cancer. So, yeah, interesting. I mean, it might, I hope that the research pans out. That's probably a claim that the FTC is not going to be too happy to entertain. But, let's not go there.
We're not going to get into the pharmaceutical business or the claims for cancer, but it's such an interesting aspect that we're funding it.
Fantastic.
So, I mean, that goes back to the point that we spend a lot of money funding research projects just to see what it does and see what the variety of stuff that xylitol can do.
Okay, folks, at this point, let's pause and allow one of our sponsors an opportunity to share an important message with you. So here goes. Listen up.
Kids don't just bring home homework, they bring home germs. And those germs don't just stay with them, they spread to the whole household. That's why Xlear nasal spray was created by a practicing physician to give parents and grandparents peace of mind. You may not think about it, but your nose is filtering out a semi-truck full of air every single day. Xlear isn't just another spray. It creates an additional layer of protection in your nose that blocks bacteria and viruses before they can even take hold. Yes, even that virus. Supporting your body's defenses right where germs first try to enter. Xlear is a hygiene product recommended for daily use, drug-free, non-drowsy, and safe for all ages. Just a quick spray in the morning and evening helps you cleanse your nose. Don't just hope for protection, create it. Get Xlear nasal spray, your daily defense. Xlear nasal spray is available at retailers nationwide and online. Check out xlear.com for our special offers. That's xlear.com.
Thanks for listening, and thanks for supporting our sponsors because they are what make intelligent medicine a continuing free resource to you. And now back to today's guest, Nate Jones, who is CEO and founder of Xlear, xlear.com. So in conclusion, so you have kind of a dual identity as, the CEO of Xlear, the company president and promoter of the products and a spokesperson. And, also I think that entails, that you've become kind of a researcher because you have a passion for the science. But you've also entered the arena of health advocacy. So where would you like to see health advocacy going in the next, few years? I mean, we're in the middle of the MAHA era, but, MAHA has had some fits and starts, and maybe we can, refine the MAHA mission by doing some things outside of MAHA.
I think that the MAHA mission is struggling. I think that some easy wins that MAHA could do and they should do is, when they first came in, when Kennedy first came in, one of the first things he did, I don't want to say one of the first, but one of the things he did in the first month or two is he fired all the dentists at the CDC.
Like because they were fluoride advocates?
Well, I don't know what it was, but I would say that that's probably the number one reason. And I actually 100% agree with that. And the reason why I agree with that, with him firing him, is not because they're fluoride advocates, but because they're dogmatic about fluoride.
Yeah.
Okay. We've known that sodium trimetaphosphate remineralizes your enamel stronger since the 1970s. Right. We've known that xylitol works to treat the bacterial infection since the 70s. The Surgeon General in 2000 wrote this big long paper, 300 and something pages, about how oral health in the United States was declining, and we had to do something about it. It's the longest ongoing epidemic we've had, that we know how to easily and safely end or mitigate in a very big way. And all that takes is for people in public health, the Surgeon General and the CDC, to actually talk about something other than fluoride. And,
there were no Charlies in effect in terms of the public health ramifications. And, I do think that there needs to be some more innovation in this field. Perhaps they're just protecting the interests of, conventional dentists in that respect. So that is one of we do see limitations because, RFK talks a good game, but he's still up against a very, very entrenched federal bureaucracy. It's the so-called swamp, which resists change.
It's a sewer. I think it's a sewer. I think it's gone past swamp.
Well, what's interesting is that the perfect metaphor is that now the Potomac River is a sewer, that literally they're pouring raw sewage into the Potomac. And as the temperatures rise, we're really going to have an aromatic situation in Washington. It's a metaphor that has come to
that's the truth. It is a sewer. It is not a swamp. It's a sewer. I mean, you see this someplace. I saw it online, but a swamp is something that is part of our planet. It's something where the water goes to get cleaned up.
It's an ecosystem. Yeah, exactly.
Yes.
Yeah.
But nothing gets cleaned up in Washington, D.C. But I think that if you had somebody, and I think that the MAHA group, if they would put people out there that would speak up, and not speak up about pharmaceutical, but speak up about hygiene, speak up about going and exercising, go up and talk about,
well, they got Mike Tyson on the exercise front, they got,
yes. And just
Iron Mike.
And just yesterday, RFK did a whole video compilation or something 2 days ago with Kid Rock.
Right. I don't know why he works out in blue jeans. Have you ever worked out in blue jeans?
Not once in my life. Not a single time.
But
when I jumped in a cold plunge, I didn't jump in there in a blue jeans either.
I want some of whatever he's taking, though. So he's pretty fit guy. So, yeah. Okay. So, yes, that's one thing. That's the bully pulpit. But, I think what's happening is that deep within the interstices of the agencies, there's still a lot of resistance. There's still a lot of bureaucrats, career bureaucrats, who don't want change, and they feel that they can outlast this administration, outlast MAHA, because after all, Trump was elected and instantaneously he was a lame duck, and so is RFK, and there may be a change in political winds, and these bureaucrats it's a permanent bureaucracy because, regardless of which administration is in power, they call the shots. And so they need to be challenged, in the way that you challenged, and, hopefully other people in the industry will step up, and perhaps with coordination and support from the Alliance for Natural Health, we can get some things changed.
Well, that's part of why I want to be a part of the Alliance for Natural Health, is because they are pushing back. They are, they're trying to push back. I think they're doing a good job of it. I think that the Natural Products Association is just teaching you how to comply.
Yeah.
And, and I want to be part of the one that teaches you how to fight back against overreach, criminal, in my opinion, criminal overreach by a lot of the lawyers that you have in these agencies.
Indeed. So you'd like to see, I think one of the principles is that there's not a level playing field between pharmaceutical drugs, which can make claims, and supplements, which are relegated to vague claims, sort of health supporting claims, when there frankly is a lot of documentation that there's no firewall between a natural substance like xylitol or a natural substance like curcumin, or a natural substance like beta glucans, or sulforaphane, or EGCG from green tea. There's bona fide science that supports the use of these in diseases, not just, to have a happy life and, freshen your breath or, maintain normal wellness. That's where we would like to get, is that we'd like to get to the point where we can actually communicate true science. And, this is something that I try to do in my program. I know this is something that you try to do in your communications. The difference being that as a physician, I have a little more leeway in sharing my opinion. You, as a manufacturer, at any point, the powers that be can crack down on you and harass, intimidate, sue, and create a bottleneck for your, truthful sharing of scientific information.
No, that's true. So any help we get, I mean, I think that people, the listeners, just talk about improving oral and nasal hygiene, talk about using supplements, talk more about exercise, nutrition, to other people. And I don't know how to individuals, can push back and try to help RFK achieve some of these goals. I just find it incredibly absurd that you can go on social media and you see all these people that are ragging on him, that are just yelling at him and calling him.
I think there's a certain amount of partisanship. I think that if he was
a lot of it
under, if he was true blue, because he started as a liberal Democrat, very much so in his family tradition, and became a renegade. And as an apostate, what happens to apostates? They get crucified. So he left the religion, and he's joined the other side.
If you ask him, he is still a Democrat.
Yeah, and which is kind of interesting because, I mean, frankly, from a standpoint of environmental stuff, he is very much a Democrat because he's all for more stringent environmental regulations in an administration which is essentially drill baby drill and deregulatory. So we have a little bit of a tension, but I think it's an interesting tension. I think that he's caught the ear of Donald Trump. Donald Trump, likes the message and likes, I think, the disruptive nature of what RFK Jr. is doing, because Trump is a disruptor by nature. And I think that he's trying to disrupt the healthcare system. He's trying to disrupt the way that we pay for and subsidize drugs in this country, looking for, alternative ways to go. So, we'll see how it pans out. Sometimes the best laid plans of mice and men oft gang agley. We don't know. So, okay. So bottom line, great products. I use them. I recommend it to patients. I recommend it to listeners. And I'm also excited that, you have become an exemplary health advocate, and, kudos to you. And it just is a testimony to your personal integrity and courage to enter this arena at great, personal and professional sacrifice. I think you stuck your neck out, but fortunately you prevailed, which is, I think, a shining example to other, companies that, want to get the word out. So just our take home is Clear has an online store at clearxlear.com. You can find all the products there and information about different products, the dental products, the nasal products, and, the products for adults, for kids, for various conditions. Retailers, all the major retailers and online, Amazon, iHerb, Lucky Vitamin, Vitacost, etc. Thank you. And now go pick up your daughters at school. Okay. Because that's important too, because you're a busy dad as well.
Well, yeah.
All right.
Every afternoon I got to go drive them around, play chauffeur.
Okay. Well, that's an important job too. And what's your billable hour?
I'm trying to figure that out.
Okay. All right. Because the meter is going to be running when you're driving, you're chauffeuring them around. Thank you very much for joining us, Nate. And, hope to run across you soon. We'll miss you in New York for the IHS conference that Clear will attend, but I'll say hi to your folks when I pass by their booth. All the best.
That works. Thank you.
I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast. I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything Intelligent Medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations.
This is Layla Muden, registered dietitian nutritionist. I maintain a private practice and see patients regularly. If you require a nutrition consult with me but live out of town, there's no need to travel to New York City. I have telephone and telehealth consultations with clients from all over the country. Please visit drhoffman.com for more information. And to set up an appointment, call 212-779-1744. That's 212-779-1744. I look forward to being a collaborator in your healthcare.